by Deputy Maurice Quinlivan.
Thank you very much, Last Concurla. Last Concurla, can I raise an issue with you about the fact that the Minister for Health is not here? And it's no disrespect to Minister Daly. I said this to you back in March as well on a similar type of topic when you came in for the Minister. I understand the Minister for Health is very, very busy. I understand that. I have no problem whatsoever with that. But he's never once come in to me on a topical issue, and normally all roughly around the same issue, around issues around at the University Hospital Limerick. So if the Last Concurla or the Concurla or Minister Daly can raise my concern with the Minister that maybe the next time I'm selected for topical that he might actually try and get in here himself, because in fairness, like when I said it to you in March, it was 13 times I tried to get him in here, and obviously it's more since then. So it's quite disappointing that, you know, the hospital that is in most crisis in the state has the highest numbers on trolleys every single day. The Minister doesn't seem to have been able to come in on one occasion. Now, I can understand he's busy, but he can't have been not able to come in every single day, every single time it's been selected, and it's simply not good enough. To be honest, I've lost the number of times I've put down the topical question. There's an issue in the hospital every single day, every single week. The full capacity protocol is used every single day. That's supposed to be a temporary emergency measure, but it's used every single day in Limerick, and that means that staff are under huge pressure. It means that elective operations are cancelled. Quite a lot of them were cancelled this week. We have 166 people on trolleys this week already. We had 46 on Monday, 63 on Tuesday, and 57 on Wednesday. But I'm really astonished to come in here today and to ask the Minister for Health, so Deputy Daly might bring this back to him, to explain why there was not enough staff to feed patients in the emergency department in the University Hospital last week. This is an absolutely crazy situation. Not enough staff to feed patients in the emergency department in Limerick's largest hospital. It's an outrageous situation. On Monday, I was contacted by somebody who works at University Hospital Limerick, and they stated, and I quote, "There is only one attendant providing food for over 90 patients in the emergency department for the last 4 days, and as no staff covers available, some patients couldn't get fed or even get a cup of tea. The agreed figure for staffing at the hospital is a minimum of 3. This is completely inexcusable. Today, Minister, there's 57 people on trolleys in University Hospital. That is more than the number of patients on trolleys in 17 other hospitals across the state put together. Can the Minister please explain the situation? I hope you or your department immediately contact the hospital management to ask what is going on. What additional funding will be provided immediately to ensure there's enough staff to at least feed the patients?
And thank you, Deputy, for raising the important issue of the challenges that are arising in University Hospital Limerick. On behalf of Minister Harris, I welcome the opportunity to address the House on this issue. The emergency department in University Hospital Limerick is one of the busiest in the country, with approximately 67,000 attendances annually. Demand for emergency department services at the hospital continue to rise, with an increase of 6% in the emergency department attendances at UHL in 2017 compared with the previous year of 2016. I wish to acknowledge the distress overcrowded emergency departments cause to patients, their families and frontline staff working in very challenging working conditions in hospitals throughout the country. Behind every trolley number, there is a patient in need of effective, timely and compassionate care from our health service. That is why this government is committed to breaking the cycle of overcrowding in our health service. As emergency department attendances continue to rise, emergency departments are under increasing pressure to meet this new level of demand and ensure the provision of timely, safe and effective care for patients. A considerable number of patients presenting to the emergency departments are frail or acute patients that often require admission. In relation to the claim that some patients are not being fed, the UL Hospital Group has advised that except for one catering attendant who is currently on leave, there is a full catering staff complement. UL Hospital Group has advised that they are managing this deficit from their relief pool. At times, there may be unscheduled sick leave that could create pressures on the service. However, full catering is available to all patients who are not fasting due to medical reasons. With regards to patients' experience, the House would be aware that overcrowding at the UHL ED has been a concern for some time. The University Hospital Limerick Emergency Department is frequently working above capacity using full capacity protocol, and this contributes to inefficient ways of working and poor patient experience. In recognition of this high demand, funding of €24 million was provided for the new emergency department at University Hospital Limerick, which opened in May last year. The new facility is triple the size of the old emergency department and immeasurably improves the experience of patients in terms of their comfort, privacy and dignity. Furthermore, against the background of increasing demand for unscheduled care services, an extra €30 million was made available nationally to respond to winter pressures in 2017, with a further €40 million being provided in 2018. To conclude, Deputy, the University Limerick Hospital Group has assured me that full catering is available to all patients who are not fasting due to medical reasons. In relation to the issue of overcrowding, I am acutely aware of the current situation and I am monitoring the situation closely. My department, the HSE and the University Limerick Hospitals Group are carrying out measures to improve the situation.
You used the word, you said the University Hospital Limerick, the emergency department, frequently is working above capacity. It's working above capacity every single day. The emergency measure is in place every single day this year. It has been in place every single day in 2017. So it's not frequently, it's every single day. And that leads to elective surgeries being cancelled, extra beds being put into wards, which is not safe. And when this measure was introduced by the HSE a number of years ago, in consultation with the nurses, they expressed huge concern, but they were told at the time it would be an emergency measure. Every single day it's used in Limerick, Minister, and it's simply not good enough. And to come in here and say it's frequently used, that's not true, Minister. So it's used every single day this year, every single day in 2017. Also, you mentioned there the new emergency department, and it is a good facility, but the problem is, as was highlighted to you by myself in this chamber, where Minister Finney McGrath came in because Minister Harris again didn't turn up that day. Minister Harris, I raised the issue that the nurses were concerned that there was a proposal to have 24 people usually on trolleys in the new emergency department, and Minister Harris rubbished that would never be the case. That wouldn't be the case. It would be happening. You'd nearly be happy in Limerick if it was 24 people on trolleys, because, as I said to you, every single day it's way over that. I wrote to the Minister back in January seeking a meeting with him to discuss ways to reduce the overcrowding problem in the hospital, because it's abundantly clear his plan for our local hospital is failing, and failing miserably. And I'm yet to hear back from the Minister. University Hospital Limerick is in a terrible state. It's constantly overcrowded and operations are being cancelled all the time. It's so unfair to make our nurses, doctors and staff work in such pressurised, overcrowded conditions. And even worse, to make sick patients lie on trolleys for days waiting for a bed. How on earth do you expect to attract nurses home from places like Australia to work for lower wages and far worse conditions? And I was proud myself to stand with those nurses outside the hospital there a number of days ago. The full capacity protocol, as I said, has been used every single day, despite, as you know, being designed only for emergencies. So what plans has the Minister? You might go back to him, and he might come back to me this time, because I've been told he will come back to me and he doesn't. What plans he has for the 96-bed extension? When will it be built? Is there any progress of speeding that up? Because the latest we heard is the plans might be ready in 2019, and we need to see the building start. Go on, good.
Deputy, and I will relay your concerns back to Minister Harris. Just to address the issue of Minister Harris not being here, I suppose it is a very fine balance, and I appreciate your frustration, Deputy, and I'm not saying this to be argumentative, I'm just saying it, I suppose, to illustrate for the House the challenges that the Minister faces on a daily basis is to get the balance right between trying to deal with issues and engage with the parliamentary process. This House places a lot of demands on the Minister's times, as does the Shannon, as does the committee system, as does the numerous, I suppose, lobby groups and interest groups and advocacy groups and representative bodies that place to hear. And the Minister every Minister has to make a judgment call on the amount of time that they spend actively engaging one-on-one with complaints and with issues, and actually dealing with the problems behind the scenes. When you go and meet with the hospital group and the University Hospital Group in Limerick, meet with the management, try and get your head around the issues that are there. So that's a continuing balance, and just to put that on the record, that it's not a snub to you, Deputy, I can assure you, it's diary challenges are always challenging, and I think particularly for the Minister for Health, above and beyond maybe some other ministries, it's probably more challenging. On the issue of the UL and the emergency department, just to assure again the deputy and to reassure, more importantly, the people that are using the facilities that there is a full catering service available at the University Hospital Limerick, and I think you may have emailed the management about it, and I suggest you should probably engage more proactively with the management. That's for you to do with the management down there as a public representative. Because the Minister doesn't, as you know, manage UL, or he doesn't manage any of the hospitals actually that are run, the acute hospitals that interbreed the country. That's done by the HSE or the management team there. But I will relay your concerns to the Minister and make him aware of it.
Move on to number